If we're talking about neck pain as in pain isolated to the neck itself, then commonly pain could be coming from the small facet joints along the neck. It could be from strained muscles in the neck, obviously. Could be ligaments, lots of ligament tissue in the neck as well. So injuries such as whiplash injuries can traumatise those ligaments. If on the other hand we're talking about neck pain that's accompanied with pain that shoots down the arm, that normally implies there's a trapped nerve there, and the most common cause for that would be a slipped disc. The other interesting thing about the neck is that there's quite a lot of referred pain that can areas that can refer pain to the neck. So commonly areas around the shoulder girdle and the shoulder blades, quite common to get trigger points and knots forming in those areas, which will produce a kind of strange kind of referred pain up into the neck, whereas actually the pain is coming from slightly lower down in the body around the shoulder blade area. X-rays are good at looking at alignment and posture if you need to have that clarified, but they do have limits. They're not going to show up the discs and the ligaments and the nerves in the spine. So, for example, if somebody's getting a trapped nerve in their arm, they're getting pain down their arm, that's not going to show the area that's causing that. If it's coming from a slipped disc, for example, in that situation, a more useful investigation would be an MRI scan. We certainly don't insist on patients having X-rays at the clinic here. X-rays, again, they do involve a dose of radiation, so in my opinion they shouldn't be used too often and kind of routinely when assessing patients. That most of the time you can get a very good idea what's going on with the neck from a thorough clinical assessment. We provide osteopathy, and most of our osteopaths will treat the patients who present to us with neck pain. They'll be using combinations of techniques, really deep massage, mobilisation, manipulation if needed, traction techniques often, and we also, in addition to that treatment, within the same treatment session, we'll often use acupuncture, which can be very good at releasing off the deep, tight muscles that can form around the neck and below that and around the shoulder blade sometimes as well. If that was to happen, then we would do our best to put that patient in touch with the right specialist for them and point them in the right direction. Probably the two most common examples of that would be, let's say, a patient who presents with severe neck pain and it's just not responding. It's isolated to the neck, and most of the time in those situations we'll probably find that there's an arthritic joint in the neck, and obviously we're not going to be able to change that too much. That patient may need to go off for some sort of injection that will be done under a CT guided injection, and we have some specialists that we work with who we trust for those sorts of procedures. The other common scenario, or relatively common scenario, if the patient's not getting better, and let's say, for example, they've got bad neck pain, it's spasming around the neck and they're getting shooting pain down the arm, that patient may have a really nasty disc bulge that is too severe that we're not able to help them. Unfortunately, in that situation, then it may require surgery, but again, we would always try and direct that patient to a recommended spinal surgeon, but certainly it's worth trying manual therapy for those sorts of conditions first, as a lot of the cases, a lot of the time, they will respond quite well. Three things I would say. First one, avoid postures where your head's looking up for too long. What's happening there is that the joints in the back of the neck are kind of crunching together, and those facet joints are getting pinched, and that could be more likely to lead to something like arthritis in the neck. Secondly, avoid what we call in our trade forward head posture. Okay, so if your head is kind of coming like this, you're on the computer a long period of time and you kind of find your head drifting forward. If you think about it, what's actually happening is, there are two things are happening there. One is your head is in front of your shoulders. So it's like if you're carrying any object that's in front of you, it's heavier, the leverage is worse, so you get more strain on the neck muscles. Secondly, in order for you to get your head up like that, to be looking forward, it's actually right at the top of your neck, it's actually the same as you looking up to the ceiling. So again, you're pinching those joints together in the back of the neck. So it's not a good idea. And the third thing I would say is, if you can, try to avoid sleeping on your front. When you're sleeping on your front, again, you will have to tend to have your head turned one way or the other, and sleeping like that for a long period of time will tend to strain one side of the neck more than the other and could lead to problems.
Thank you for watching this video all the way through. For effective treatment and advice for muscle and joint problems throughout the body at either of our clinics in Chigwell or Woodford, call us at SpinePlus to book an appointment on 0208 501 0937. You may like to know that we've made several other videos with information and self-help tips on specific problems, everything from tension headaches to heel pain. Some of our suggested videos are shown below, or you can search our playlist to discover more. We'd also be really grateful if you could like and share any videos you watch, and please subscribe to our channel by clicking on the subscribe button to be kept informed of our latest information. For more information on our clinics, click Find Out More to be directed to our website.